what hybrid would you get?
For myself,
Yes.
okay. Zirconia is more cosmetic. I like that about that. But maybe I will pick the zirpeek.
I think I will go for the zirconia, the full zirconia.
But I think I would go for the zirpeek also. And why? Because
But on the bottom, I've zirpeek.
Yeah, so we need to choose an option for every single patient. There's not always just because the patient wanted, we can just do it.
so the immediate loads are the closest thing to having your final work,
Exactly.
but just temporarily because of the material that we use or how we use the material. Correct?
Yeah, exactly.
Some people don't have too much room. And the zirconia bar, it needs less room and looks more cosmetic.
Yeah.
Welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Remember, this podcast was meant for you, the patients. And today we have our in-house, very own 3 doctors. We have Dr. Joel to my left. We have Dr. Ivan. And we also have Dr. Luis. So one of the things that I want to speak to you guys about today is I want to go a little bit more in depth and spend a little bit more time on immediate loads, on exactly what's an immediate load and what are the benefits besides walking out with teeth already for our patients, because our patients have many, many questions on that. It's something that they normally don't hear of in a lot of other clinics. So who wants to start the conversation?
Okay, first. Okay.
So, Frank, that's a good subject that we can touch today, that we can speak about, because immediate load is something like we can say is kind of new, a new technique or something, a new research that we can use. And one of the things that we can say it's an advantage on this kind of treatment is we can give to the patients teeth. They will not moving, so like not permanently. It will be temporarily, but it's not gonna be like a normal denture that will be rocking or will be moving. So the patient will feel like more comfortable. The recovery will be more comfortable, and it's something that we, as the name said, we can give him like immediately load to the implants.
Okay. So the immediate load doesn't have the upper palate.
It does not. I mean, it's just like a horseshoe, like the shape of a
Of
an arch,
Yeah.
of an arch, and it will be just holding by the implants, nothing into the palate. That's another advantage that we can offer.
So the immediate loads are the closest thing to having your final work,
Exactly.
but just temporarily because of the material that we use or how we use the material. Correct?
Yeah, exactly.
Okay.
That's correct.
Another good advantage is, for example, on the second visit, when the patient come back for the final permanent material, is no painful appointment because we don't need to place shots, for example, because it's necessary to remove the immediate load, take the mold, send to the lab for the permanent material. But if you compare this procedure with the old school or when it's a removable denture, in the second visit is a painful visit. Why? Because I need to place a shot again to open the connection of the implant. That way in my opinion, is a good advantage.
Yeah, well, and to retouch a little bit on that. So when the patient gets normal dentures, 6 months later they come back in. 6 months or after 6 months, they come back in and you guys have to cut around the gum where the implant is. Cut the gum. And then put a healing cap, and then they come back the next day
for the mold.
And then it depends on the gum how it heals, because it that has a big factor on when you guys put the multi-unit, and also it's more natural. Because it's already when you get immediate loads, you walk out of here with the multi-units already in your mouth. So when you come back, the gum's already healed.
Around the multi-unit.
Around the multi-unit that's
Yeah.
going to be used. We don't no longer have to do shots.
Yeah.
We no longer have to cut and
Yeah.
inflame the area. Everything's already pretty much done. All that
Yep.
process is done.
Yep.
Okay. All right. Right.
Okay.
What other points you guys got?
Something good to add is about the clinical proof of the gums healt. When we're doing the immediate loading, we can get more thickness of the tissue, and that helps to keep the implants longer.
Huh.
Yeah.
Yeah, we can start management the tissue since the very first appointment. So we start put the size and the height of multi-units. We're gonna select those since the very first appointment, and that will help us out to start, as I said, manage the tissue since the very first time.
What do you mean by manage the tissues? I'm a little bit lost there.
I'm more talking about like the removable dentures because it's rubbing on the
Yeah.
healing part of the gums.
Oh, the gums, okay. Okay.
Can make more bone loss around the implant surface.
Of course. Yeah.
And the immediate loading help to keep and stay the keratinized tissue.
Yeah, actually,
Uh-huh.
there is a lot of cases that we have, and we've actually have them documented of when somebody comes in and gets their implants on, they get their implants, and they get just temporary dentures. There's normally bone loss. There's normally, and this is a study, that there's normally anywhere from 15 up to 27% or 30% bone loss. You could see 1, 2, maybe even 3 threads of the implant uncovered.
Exposed.
But if you get the immediate load, because of the bone stimulation,
Yeah.
you know, the implant stimulates the bone because
The cells.
it acts as if nothing was ever gone. Then the bone loss is, in what I was reading online, is it's from 1% up to 5%. So it's very minimal compared. So what does that mean? Us not being dentists, what that means is that you'll have a lot more bone around your implant, meaning your implant's a lot more stable and stronger for years and years and years to come. So you come back in, and the x-rays that we see when you leave, if you get normal dentures, you come back and there's bone loss, and it's normal. But you come back after the immediate load, and most of the time it almost looks identical, like if nothing happened, like the bone is still up to where it should be. And that is huge. That is huge, because for you to have that bone loss, it's going to take so much more longer than it would from the beginning with the normal temporary dentures.
Welcome to Dental Facts. Did you know flossing can extend your life expectancy up to 6 years because it reduces the chances of infectious diseases and can even prevent heart attacks? You heard it first at Supremedental Podcast. Floss, brush, and keep smiling.
That's correct.
So on my perspective, which I'm not a dentist and everybody knows that, is patients hate when the temporary dentures fit loose. Like they come in, they get their extractions, they get implants from you guys, they walk out, and it could be 2 weeks later, it could be 2 days later, it could be 3 months later. Their gums are going to start shrinking, and the temporary denture is going to start fitting loose, and Fix-A-Dent is going to be their best friend. So what does most patients do? Most patients, being sincere, they grab those dentures and they don't wear them.
You don't use them. No.
They put them in a drawer, and they just wear them when they're out and about, if that. So when they come back in and we ask them, you guys ask them, hey, have you been wearing your dentures? A lot of them will say yes, but you can tell because of the dimension when you put them on, they don't know how to bite with them anymore, because now instead of having the teeth and bite like this, you take that off, and now they got to bite gum to gum like this.
Yeah.
So I've said it before, it's kind of like being barefoot or wearing sandals and go to the beach for a month and then come back and wear dressing shoes. You're like, wow, did my feet get fatter? No, your feet's probably the same, unless you get crazy, but your feet's probably the same. It's just that you're not used to having that pressure.
Exactly.
And in your mouth, you could feel every single thing. So you will feel a big difference. You'll feel like these teeth are too big, even though they're not too big. It's just the way that your bite, that your jaw and everything should align. And that's a really big factor, because then you at home, when you get back home, it's going to take you weeks, if not months, to get back to that normal rhythm. And we're going to tell you, look in the mirror and bite. That's your natural bite. That's your natural bite. You need to train yourself to do the natural bite. When if you would have warned them, you would have probably not had that issue. But now with immediate loads, you can't take them off.
Yeah.
So then you're going to learn how to bite. So by the time you come back in, everything is a lot more natural.
We can keep the bite, the dimension of the bite, the original dimension.
Yeah, the patient get here with immediate load. The immediate load is perfectly fine. We just take an impression of that same bite that he is used to it for those 4, 5, 6 months, and just keep it for the new ones, for the final ones. Just change, make a change on the material. So whatever the patient gonna choose. I mean, we have many options. We will talking about that later. But yeah, we can keep the same bite that the patient already used to it.
So what about one of the big things that I think, obviously this is not something that we train. This is like, sometimes we sit down here and these are not actors, and they're real dentists. And a lot of the times we say, what are we going to talk about? And we talk about it within 30 seconds and we just let everything go, because we want it to be as natural as possible, as if you were here with us and we were explaining to you. Like if you've been here to the clinic, you know that Dr. Joel and, Dr. Ivan, Dr. Luis will explain to you. If you guys happen to see me in the waiting room, or I happen to be walking around and you need other explanation, I would explain to you. And this is the way we explain things. So you're going to get the VIP backstage to this. But talk to me about when you get immediate loads, that now you can perhaps, if you're a candidate, come back in 4 months instead of 6 months. Because that's huge. That's 2 months of not wearing the conventional denture and you having your final process.
Yeah, that's something like another advantage that we're going to have, coming back in 4 months instead 6, because of the thing that Dr. Luis was explaining you before. It was cells stimulation, like making the tissues. Tissues, I'm talking about gum and bone, are stimulating every time we use them. And now if the implants get torque at the very first day, we make sure the implants get more than 40 newtons of torque. I don't know if you can understand this, but it's pretty easy to understand. 40, 45 newtons of torque, that's, I mean, more than 35, that's enough. But if they get torque in the very first day, then the 2 or 3 month will be the healing process. And at the 4th month, they're supposed to be completely healed, because of this cell stimulation will make it a little bit faster. So otherwise, we need to leave them 6, because it's the normal way to do it, without an immediate load, and hope the implants just heal properly. So we're not gonna know until we open the gums, torque the implant, and just see if the implant just get healed totally fine.
Yeah. No, and how many times did someone had like a normal denture, and then we tell them fix the dent, but then they go to Walgreens or whatever other store and they add something weird that grafts onto their gum more and gives them sores, or could actually rub wrong on the gum itself and affect the implant itself. That's a big thing also that we used to get here a lot.
Yeah.
Now, another big topic that we get, and today we're going to talk about different topics that patients have been asking, is they want to understand the difference between an all-on-4 or all-on-6 made with acrylic, a difference between an all-on-4 or all-on-6 made with the zirpeek, and the all-on-4 and all-on-6 made with full zirconia. Who wants to lead me in that pathway?
Good question. Is, for example, depend of the mouth condition, the smile condition. Because, for example, when it's a high smile, my first option is to do a full zirconium. Why? Because with the full zirconium, we have only one structure, only one material. If you compare with the acrylic, we have 3 different materials. It's the metal bar, the acrylic, and the teeth. 3 different. It's necessary to do a more longer structure. Imagine with a high smile, you can see the transition. That's why in this case I need recommend a full zirconium or a zirpeek, but zirconium is better than acrylic and zirpeek in this case.
Okay. All right. What about you guys?
Also, could be about the rooms. Zirconia needs less room, less thickness of
Yeah.
material. For some people, there's something we call them vertical dimensions. That's the distance between the upper and the lower jaw. Some people don't have too much room, and the zirconia bar, it needs less room and looks more cosmetic.
Yeah.
Yeah, so we need to choose an option for every single patient. There's not always just because the patient wanted, we can just do it. So it happens with other kind of treatment like
Right.
crowns or veneers, or in this case we are talking about Allen 4. Some patients want, okay, I want to have an Allen 6, and we want to help him, but if it's not enough bone, there's not enough bone, so we cannot just do it. In this case, as doctor said, if the patient has not enough room for a kind of denture, so we need to choose the one that's gonna fit better on him. Like zirconia will need, as they said, need less space, and we can do it when the patient has a very high smile or more bone than we're gonna need. And the acrylic ones we're gonna need it in another situation. So we need to choose it well.
So George is gonna put right now videos on. We're gonna start with the acrylic. So the acrylic is a metal bar surrounded by acrylic
Yeah.
with composite teeth.
Yeah.
That's the one that we have. That is the acrylic hybrid. Okay,
Hybrid.
correct?
Correct.
Yep.
Yes. Yeah.
That one is. There's nothing wrong with that one. That one is great.
It works good.
That's a
Yeah.
good. That's a that I think
natural.
maybe that was one of the first. Was that one of the first All in 4 that was offered
Yeah,
to
it's
the public?
supposed to,
Yeah.
yeah.
Because the most popular one, because it's been around for probably the longest,
Mhm.
and everything has been getting better and better and better. Now, what are the biggest let's talk about the good and the bad. So the good thing about the acrylic is obviously that you're gonna have teeth again, and it's the most economical.
Exactly.
Yeah. Exactly.
So it's the most economical one. Now the downfall is that it's very easy to lose a tooth
Yeah.
because the bar doesn't grasp on to the composite tooth. The composite tooth gets put on the acrylic portion of it.
Exactly.
So when you bite down very hard, you always have that possibility that a tooth can pop out.
Yeah, it's not the same to having three materials and one structure to just have one structure made it of
Yeah.
the same thing like zirconia. So it's kind of obvious.
Okay, perfect. So that is the acrylic. Like I said, there's nothing wrong with the acrylic. We have it in many different promotions. We have patients that love it, but it's a common issue not with Supreme, but overall anybody in the dental world. Actually, a lot of dentists that I've been that we follow on Instagram and that you guys been training to don't want to do acrylics because a lot of patients when you get a hybrid, most of them obviously didn't have teeth, and a lot of places don't offer immediate loads, so now they're not used to biting and they cannot measure their bite.
Exactly.
So then, because now your roots are made out of titanium, or zirconia, whatever implant you use. So then when you bite down, you don't feel it, and they put a lot of strength on their bites. And that makes normally this portion pop out, right? It's normally
Yeah.
not the
Front
molars.
ones.
Exactly.
It's
Yeah.
the front ones. So that's number one. Now let's go with number two. The zirpeek. Talk to me about the zirpeek. The zirpeek is, if I'm not mistaken, a zirpeek structure which replaces the metal bar, and then it has little nubs, like if they prepped up your tooth. Then it has composite, the pink portion of it, which is the gums, and it has zirconia crowns cemented on. So it has 3 different materials. Talk to me about that one, guys. The zirpeek.
One advantage of the zirpeek is because one is because it's flexible. It's a flexible material and it's stronger too. 2 qualities on the same material: flexibility and strong. That's why sometimes I recommend this material. For example, when we have very strong bite, very very strong. We can check this problem. In my mind, I can imagine on the future this patient can break for example, the full zirconium with this patient is probably can break. But with the zirpeek, I can give you a different material with more flexibility qualities. It is because every patient is very different. Okay, but the zirpeek works very very good in patients with a stronger bite. Yeah.
Okay.
It preserves the implants because it absorbs the strength of the bite.
Yeah.
That's why it's a good quality of the material.
Yeah, another advantage that we can talk about zirpeek is if for some reason one of the crown break off, it's pretty easy to solve. We don't even have to take it out. Just take an impression or a scan right now, send it to the lab, and it just will be ready at the next day. So it's pretty hard to replace a crown in case a patient break it.
Yeah.
So,
It's very easy to fix.
It's very easy to fix.
Easy to fix.
Yeah.
All right. Also, it's very aesthetic.
It's much. It's way better than way more cosmetic than
The
acrylic.
acrylic. The acrylic.
It looks more natural.
More natural. Okay. Another thing is that it, if I'm not mistaken, it acts. You know, when you have teeth and you bite down, you have that shock absorb. You know, the shock is absorbing, and with the zirpeek, it does that also, right? When you bite down, the peak material absorb the hit just like that. It's the closest to the bone, like it's the closest to a natural stimulation could be to the natural observation of the bite itself.
Yeah, because remember when we have teeth and we bite something hard, or teeth has ligament and it has nerves, and we brain will register when we are biting something really hard. When we have implants, so the implant has not sensitivity, has not nerve, and if we bite something hard, if we put something hard in between the teeth with a zirpeek or acrylic or whatever, we're not gonna feel that is hard, and we're gonna bite down with all strength, and we can break whatever we put on the middle, or whatever we put on the mouth. So talking about the structures, so the zirpeek, if you have a little bit of cushion or a little bit of shock absorber, you're gonna make when we bite down, you're gonna like absorb a little bit of the strength of a bite
Off of the implant itself.
Yeah.
Okay. How easy is for a tooth to break off?
Like a natural teeth or
Compared to the acrylic?
compared to acrylic?
On a zirpeek,
Yeah.
it'll be harder to do it,
Yes.
obviously,
It's a little
because a composite teeth will be weaker, and the crowns on a zirpeek are zirconia, so it's the same chance to break one of those than a normal crown of zirconia crown. Yeah.
Okay. Now talk to me about the zirconia bar. The zirconia bar is what material?
This is one of the first and one of the biggest advantage that we have. Making it just one material obviously will be stronger because we don't have to one over the other or putting something like on the top of it. So it's gonna be obviously stronger, and zirconia now is, I think, the stronger crown that we can make, or the stronger material that we can use for crowns. So obviously, making a one structure of zirconia will be stronger than anything else that we were talking about.
Another thing is, for example, when it's a full zirconium, we can do a perfect occlusion, a perfect bite, because with metal and acrylic or zirpeek, we have different components. The occlusion is good, but it's not. If you compare with the zirpeek, the zirconia denture, the occlusion we can see is perfect. All teeth, the molar, the premolar, the front teeth looks in a perfect occlusion. In my experience, we can see this big difference with another structures. All the structures works very good, but this denture is more exactly.
Yes, could be because when you're placing individual teeth,
Yeah.
or like even the acrylic teeth, if one is not during the fabrication of the material, if one is not placed correctly or during the test, something can be different, something can change. And because the other one is a full piece of teeth, and also it's made in computer.
Yeah,
it
it's
get
made in a
better.
software.
It's made in a software, yes.
It's a point is one contact by one contact in HQ speed on the molars on in a localized area on the molar is that contact. That's why it's
Get
different.
better.
Yeah, it's better. Yeah.
Now, but the zirconia one does weigh more, right? It's heavier.
That's
Yes.
we can. I don't know if you call it like disadvantage, but yeah, it will be heavier because the zirconia as well is that's the material is kind of a metal. It's oxide of zirconia is kind of a metal. That's why it's strong, but obviously will be a little bit heavier than the
Actually,
than the other.
when you guys are bringing it down, it sparks.
Yeah,
Correct.
it sparks. Yeah, because it's
Sparking.
very hard.
It's very
That's
hard.
why it's very strong.
So we could say, if we could even call that a downfall, a disadvantage, we could say that it's heavier.
Heavier.
So it's not for everyone.
Exactly.
Yeah.
That's why I told you before. Like we have to choose very well.
Yeah.
It's because depends on the patient.
Yeah.
And the positive of it is that it's one solid piece.
Yeah.
It's very aesthetic.
Yeah.
And also, you say that when you don't have enough space, the zirconia one would be the one to go for because it's one part instead of the acrylic one that has the metal and then the acrylic and then the composite. And all
Yeah.
that.
We need less space to
Less
make it.
space.
Let's,
Now on the zirpeek, I don't think we did it. What was the downfall of the zirpeek? What's the? I mean, or if you can find one, what's the one thing that the lowest thing you guys like?
About the
Zirpeek,
Zirpeek.
yeah.
Could be the color of the gums.
The color of the gums?
With the zirconia, look more natural.
Look
The gums look more natural,
Yeah.
Okay.
like the fake gums.
I don't remember another disadvantage. So another thing
The-
could be
the
isn't
anat-
that
The anatomy, for example, when it's a full zirconium, all components, for example, the teeth, the gum, is what is the name? The gum termination looks very very natural because remember it's only one structure, but when it's a zirpeek, I need we do the crowns on the gum with the hands. For example, the color gum is made with hands,
Yes.
not with the computer.
Everything's done separately.
It's yes,
And then
everything
stick
is
together.
separate. Yeah.
another disadvantage that we can say about therapy could be it will need a little bit more testing, like more steps to get there, one test with the structure and then one test with the crowns before to make them, and it could take a little bit longer to do it.
If you ask me, one of the disadvantages for the zirpeek is that you could floss. So then a lot of our patients want to floss up and down, and they could if they don't floss right, they'll grasp onto a crown and they'll keep on doing it until one of them comes out, instead of flossing up and pulling out, flossing up and pulling out. And I think that gives more options to a patient
To make a mistake.
to make a mistake.
Yeah.
But to me, I mean, obviously acrylic is amazing, but the zirpeek and the zirconia are the top that there is.
Yeah.
But they're both very aesthetic, but they're both very different. And like we said before, these are not one size fits all. It's not like, this is every situation's different. Every single situation's different.
Yeah, we just need to pick up the right one for the patient at the moment.
That's awesome.
Yep.
Well,
That's
those are the things that patients actually ask the most about.
Right.
I know that we are about to go into a pick training, and I think the pick will really benefit all of the hybrids, but exclusively, I think that it will help the zirpeek and the zirconia, but perhaps the zirconia even more, because I think it would be done the fastest. But everybody knows that when you have more hands in, then there's room for more mistakes. So being one material, less mistakes.
Yeah.
But then again, if one tooth breaks, we got to replace everything because everything is one piece. And the zirpeek, if one tooth breaks, you could just replace that tooth.
It's easier to replace and faster.
So it's kind of hard to choose. But I'm going to do this again. I did this before. Dr. Ivan, if you had to pull all your teeth out, what hybrid would you get?
For myself,
Yes.
okay, zirconia is more cosmetic. I like that about that, but maybe I will pick the zirpeek because that's gonna keep my implants longer. For some people who don't have enough available bone, who are getting like short implants, we need to preserve as more bone possible. And the bigger disadvantage I can think about the zirconia, it looks so much more cosmetic. And but the zirpeek, I like it because it's not gonna be a lot of strength going to the implants.
Okay. Dr. Joel, tell the camera, what would you do? What would you pick?
I think I will go for the zirconia, the full zirconia, because obviously we're always looking for the most cosmetic thing. And yeah, obviously the thing that Dr. Ivan is totally correct. But we are looking to be good looking. And actually the strongest material will make it last probably longer. So we will not have broken teeth, or I probably keep it for a longer time without any accident or without any break off thing.
Dr.
Well,
Luis?
I think
He likes acrylic.
for myself, probably two different. On the top, full zirconia. I like it. It's the best quality, cosmetic quality. But on the bottom, I've zirpeek, because with a pick, I can absorb all pressure on the top full zirconium denture.
Yeah,
Two
it could
different.
be a mix of
Yeah.
both. So that's great.
Huh?
Yep.
I thought you were gonna say the cheaper one.
Just to let you guys know, there's a rumor going around here that Dr. Luis is pretty cheap. I mean, it's just a rumor. He says one time he bought lunch for everyone. I don't know. It's like a myth because I've never seen it, but it's supposedly a rumor that once in a lifetime when he was in the university, he bought lunch for everyone, but it wasn't here. But and if I had to choose, I would choose gold. I'm just kidding. But I think I would go for the zirpeek also. And why? Because I'm very picky, and I would probably want to change my teeth. If I want to change something about it, then I could probably would say I don't like the front four. Then I could just exchange them.
Yeah. Make it bigger, wider.
Make
whatever.
it big. Yeah, exactly.
Yeah.
But that's me because I'm extremely picky. George, which one would you get?
The plastic one.
Yeah. You get the plastic one.
Yeah. Full plastic.
Just to let you guys know also, and very, very soon we're going to be in Apple Podcast and also on Spotify. So we'll let you guys know as soon as we are, so you guys can listen to us while you guys are in the car, working out, or being cheap like Dr. Luis. I'm just kidding, Luis. But thank you so much for joining us. Thank you so much for joining us today, guys. I know you guys are super busy. I know that I always say this, and it sounds like it's planned, but you just came out of a surgery. You were during a surgery. You've been with patients today, too. I don't know if you guys have patients afterwards. Dr. Elias really wanted to be here, but he's in surgery right now. And if I could put a window right here, he would probably be in surgery and looking at the camera and answering some questions because he wants to be in the podcast all the time. But thank you so much for joining us. And hopefully we answered all your questions. Put your questions down in the comments. Put exactly what you guys are looking for and what questions you guys got. And we got the talent here. We got the creme of la creme to be able to answer you guys any questions. So, and this has been an episode of Supreme Dental Podcast powered by Supreme Dental. Have a good one. Keep on smiling.
Thank you very much.